breath and pull up. 1, 2, 3, 4, 5, 6, 7 to the floor.
How's the pain?
None.
Let's go do the stairs and see what that... All right, we're here today on this beautiful day with Lee. Oh, God, it's gorgeous outside. Okay, Lee, let's talk about those knees. How long have you had the knee problem?
A little over a year.
Okay, have you seen any other doctors?
I've seen an orthopedic.
And what did the orthopedic do or say for you?
They repaired the meniscus in my right knee and said I have bone on bone. And the left knee he hasn't touched, but it's doing the same thing as my right knee used to.
And that he has told you bone on bone? And what is his decision to do with bone on bone?
He said eventually I'll want to have a knee replacement.
In both knees?
He hasn't said that on the left knee yet.
Okay. So what kind of challenges are you facing with the knee problem?
Well, I'm newly retired and I want to be able to travel and play with the grandchildren and just be more active because I now have the time.
Right.
I can't.
And you want to be pain-free.
I want to.
And you want to be able to do it and stay active.
Absolutely.
Well, you're at the right place. All right, so your discomfort level today we discussed from 0 to 10?
Yeah, it's probably about a 5 today.
Okay, and are you normally taking some kind of Tylenol or Advil or something?
I take Motrin a couple times a day.
A couple times a day, and you're taking it every day?
Yes.
Okay. All right, well, we got to get that so you don't have to take that any longer too. All right, Lee, I'm going to have you stand up for me. Any discomfort or any tightness or anything when you go from sitting to standing?
Not so much, no.
All right. I'm going to have you take 2 steps forward. There you are. Feet shoulder length apart. Arms straight out in front of you. And I'm going to have you squat down as low as you can go. And slowly come back up. Okay, where did you feel it there?
The top of the knees.
The top of the knees. Okay. All right, so next thing I'm going to have you do is go up and down the stairs for me. And turn around and go back up. Okay, so going up and down the stairs, which was more difficult for you, going down or coming up?
I think they were about equal.
About equal. And where were you feeling the pain and discomfort?
On the outside of the knee.
On the outside of the knee. Okay, so out of all the exercises, which one was the most difficult?
Stairs.
The stairs. The stairs was the most difficult for you. All right, you ready to get started?
Yes.
Let's go.
Deep breath and pull up. 1, 2, 3, 4, 5, 6, 7 to the floor.
And here she comes. Too bad it wasn't a red carpet, right? She's smiling. How you feeling?
Awesome.
What changes have you noticed?
It's loose.
It's loose. You don't feel as tense and
No.
tight?
No.
How's the pain?
None.
Let's go do the stairs and see what that...
Does.
All right, we're back with Lee. Lee's finished her first treatment with Dr. Davis. So Lee, can you stand up for me? Ta-da! All right, 2 steps forward. All right, feet shoulder length apart, arms straight out in front. How low can you go? Whoa.
A little too low.
Let's try that again. I know you feel good, right? There you go.
I do.
That's awesome.
I do.
That is awesome. Okay, let's go up and down the stairs. That was your biggest challenge, was up and down the stairs. And look at that. How are you feeling?
Better. Better. Yes.
So your discomfort level was a 5. What do you think it is now?
It's probably like a 2.
Okay, we haven't even done therapies yet or anything. So what is the biggest thing that you notice about after Dr. Davis has done his non-surgical operation? What is the biggest thing that you're noticing?
I feel looser and more stable, actually.
So you feel like you're almost stronger?
Yes.
Perfect. That's exactly what I wanted to hear. All right. Well, happy Valentine's Day.
Thank you.
I hope you have an awesome day, and let's get started on some therapies.
Okay.
All right.